So today we are going to dive into something that many people don't think when we say longevity, your oral health. I'm excited to introduce Dr. Mina Aziz,
Thank you.
our medical director plus general and cosmetic surgeon in BioInsights. Welcome, Dr. Mina Aziz.
Welcome, Mr. Nishanth. It's my great pleasure to be here.
Thank you for being our first guest in the podcast.
My pleasure. My pleasure. I'm really looking forward to this and looking forward to how I can guide everyone to have a good oral health and how oral health could impact their life significantly. And that's what I'm looking forward to today.
Good, doctor. So the very basic point is we are a longevity and precision clinic,
Mhm.
but no one associates dental hygiene or dental procedure with longevity or precautionary treatment. No one associates with it. So what's your comment on it?
I totally understand this because, always, ever since dentistry came to existence, people would only go to a dental clinic for a specific purpose. Like, for example, if they have a toothache or tooth pain, they want to make any certain cosmetic procedure. But they don't usually go to the dental clinic for the long term aspect of oral health. And here in Biolongevity Precision Health and Longevity Clinic, we want to focus on this long term oral health effect. We want people to live long lives with the best oral health possible, because like any damage in the tooth surface is
Mhm.
irreversible, and if you lose your teeth in an old age, you cannot have teeth back
Right.
unless other procedures like implant and
Mm-hmm.
so on. No problem with that, but like natural is always better.
Hmm. True. So I think we just have one set of teeth. So after you are grown up, you just get one set of teeth, then you're done with it. That's it.
Exactly. You see, like teeth specifically, it's like a gift from God. At the end of the day, we want to smile. Smile gives us confidence. We
Mm-hmm.
want to eat, and we need our teeth to be able to eat all kinds of food. And losing one tooth, for example, will negatively impact our enjoyment of eating. Having a decayed anterior teeth or
Mm-hmm.
having for example, crooked teeth, it will psychologically affect us, in our ability to smile. If you're not confident in your smile, sometimes you don't want to show your teeth when smiling, and sometimes you will cover your teeth while
Right.
smiling, and we want to improve that.
Right. So, what are the basic dental hygiene that everyone should follow? Like, what are the ABCDs? The most basics of dental hygienes.
So the basic thing, okay, is to get to know your own teeth
Mm-hmm.
and to know your own gums and to know your own self.
Mm-hmm.
Okay, everybody is different than each other.
Okay.
For example, one person, okay, consuming a certain amount of sugar could
Mm-hmm.
be totally fine.
Okay.
Another person consuming that same amount of sugar could have
Hmm.
decayed teeth. So we are
Hmm.
all different than each other. So, uh, so through some kind of microbiomes testing and genetical analysis, you can know who you
Mm-hmm.
are and know what kind of teeth and oral health you have. And based on that, okay, you can develop a nutritional lifestyle that
Mm-hmm.
suits your teeth. You
Mm-hmm.
can have your own personal oral hygiene habits,
Mm-hmm.
your own specific type of toothbrush, and which toothpaste works for you,
Oh,
and
wow.
so on.
Okay, well, very good point you said. Like every person or teeth is different. So for my example, so I have multiple toothaches, tooth decay, but I don't drink, I don't smoke, I really take sweet drinks. But on the other hand, my friend who drinks, smokes, and everything, right? Their teeth are perfectly fine. So I
Yes.
always thought, like, why is this? Why is this happening to me?
Yeah.
But I can see your point now. Every person, every teeth is different.
Yeah. So it's clear now.
Yeah.
Yeah.
So how would you find it out? So how would you find out like what are the different microbes? I think you touched upon microbes, right? What is the procedure? Like what is the reason to do that?
So basically, you present to the clinic and you do a microbiome testing,
Mm-hmm.
and we will make the test results, and then we will have the report, and we can guide you from there in uh, what kind of toothpaste you need, what you need to address,
Okay.
that kind of thing.
Okay, perfect. So is it for every age group? So like from kids, from old age. Like what is an appropriate age for oral
So,
hygiene? Yeah.
so in general, oral microbiome is for like all age groups. However,
Mm-hmm.
I strongly like prefer like after age of 12 when people have their adult tooth already
Mm-hmm.
available, because like there are differences like could be in the oral microbiome while you are like having a mixed dentition. Some teeth are shedding and they're followed by eruption of other teeth
Mm-hmm.
and so on. It's also good to know yourself in that time, but like starting after the age of 12 to 13, when you have your complete set of teeth present until until forever.
Okay.
That's when you could know yourself for a very long time.
Okay, nice. So getting an oral microbiome done help in other regard also. Like for example, bad smell, right? Bad smell is a problem I've seen like a lot of people.
Yes,
Periodic gum disease. So all it helps in all those different.
yes, of course.
Nice. What does that you do, your doctor, in the clinic? Is there any particular advanced procedures you do, or in the clinic, especially in the biology clinic?
So in biolongevity clinic, where it's like I
How
I
would
address,
biology clinic separate from other clinics, like in at least the dental regard?
well, at least in the dental aspect, it's like we get you to know your teeth better.
Mm-hmm.
Okay, we teach you how to take care of your teeth to allow
Right.
them to be long lasting.
Mm-hmm.
Okay, and that being said, we also focus on treatment. All
Mm-hmm.
right, there's no point in like trying to tell you brush your teeth every day and do all these things while you need treatments that's not done.
Sure, got
Right,
it. Yeah.
you need to get your treatments done. If you have a
Mm-hmm.
tooth decay, you
Mm-hmm.
need to get it filled, or it will require root canal in the future,
Mm-hmm.
and some occasion you will need to have your tooth pulled out, and we don't
Okay.
want to reach to that level.
Mm-hmm.
So we guide you in treatments first, and we teach you how to take care of your oral health,
Okay.
and then we proceed with the oral microbiome testing to give you the precision way in
Mm-hmm.
how to uh, to brush your teeth, and how what kind of toothbrushes you need, what kind of toothpaste you need, what
Mm-hmm.
kind of mouthwash you need that is precise for you as an individual.
Got it. So is there any food or food you suggest that someone should eat, or is there any like precautionary methods, or something that we can do at our home? Is there some steps that you prescribe for our patients?
In my own personal opinion, I believe everyone should follow uh, a proper nutritional diet.
Okay.
Okay. Um, to be honest with you, sugar is the number one enemy of all teeth.
Right. Okay.
Right, but people are responding differently.
Right.
As I mentioned before,
Uh-huh.
someone is gonna have decay early, and someone is gonna have delayed decay maybe after years,
Mm-hmm.
due to the genetic makeup of the tooth structure and the susceptibility of
Okay.
performing decays.
Mm-hmm.
So, but in general,
Mm-hmm.
in general, you must have proper food.
Mm-hmm.
Your sugar intake should be natural sugar from fruits.
Okay,
Okay.
not processed, like natural sugars. Oh,
Yes.
got it. Yeah.
You understand?
Yeah.
Now, let's talk about this in a more realistic approach. Okay.
Okay.
Any dentist will
Uh-huh.
say, do not smoke. Okay.
Mm.
Do not consume sugar.
Mm.
But is that realistic?
So
We are
yeah,
all
we can't let people like devote tell them stop anything,
It's
but
not
they were not
possible.
gonna do it.
You're
Yeah.
not gonna do it.
Uh-huh.
But when I tell people decrease,
Mm.
all right, instead of
In moderation.
yes, for example, if someone is having 3 tablespoons of sugar in
Mm-hmm.
the cup of tea, okay, I could like instruct to have only one spoon of sugar.
Mm-hmm.
Okay, it affects a lot. All right,
Mm-hmm.
your sugar consumption has just been divided by 3.
Yeah.
You,
Okay.
you understand what I'm
Got
trying
it.
to say?
Yeah.
If you are smoking 5 cigarettes a day, try to decrease them to 3 cigarettes a day, and
Hmm.
hopefully, I wish everyone would stop smoking because it has really harmful effects on your
True.
oral health.
Yeah.
However, I totally understand that smoking could be fun for some people and
Mm-hmm.
stopping it is almost impossible for some. So I would advise decrease it, enjoy it on weekends,
Mm-hmm.
right? Don't smoke every day. You don't need to smoke every day.
Right, yeah.
Okay, at the same time, you don't need this type of enjoyment every day.
Mm-hmm.
However, okay, we're not all like monks or something. We're not all like this type of dedicated people.
Got it, yeah.
For an average human being,
Mm-hmm.
okay, it's okay.
Mm.
Smoke, but like make it once a week, for example,
Mm.
once a month, for example. Try to decrease it, okay?
Right, so
And that's psychologically
mm-hmm.
a realistic approach to
Mm-hmm.
decrease smoking, and so with sugar intake. But if I'm going to tell you just stop this, stop this, stop this, directly after you exit the clinic,
Yeah.
that's the first thing you're going to do.
The first few days you're gonna stop it, then again it comes back.
You know, like some patients I had,
Yeah.
immediately the first thing they would do after exiting the clinic, they would have a Snickers bar, for example.
Okay, got it.
Yeah.
Yeah. Okay, so what are other fun stories you have with your patients? Have you had any experience that you don't forget?
Well, let me think about that for a sec.
Okay.
Oh yeah, let's talk about smoking. Smoking is really funny one.
Mm-hmm.
Okay. Back in the days, I had approached stop smoking, all right? Because like, why not? I'm not a smoker myself, so
Okay.
I didn't understand the difficulty of quitting smoking since I'm not a smoker,
Got it.
and I just approached this in a dental aspect. Smoking is bad for health. So don't smoke,
Mm-hmm.
okay? So I had this last patient,
Mm-hmm.
okay? I performed a cleaning procedure for him.
Okay.
Okay, I told him don't smoke.
Okay.
Specifically, don't smoke today.
Uh-huh.
Okay, but because I combined that you shouldn't smoke in the same day of treatment,
Mm-hmm.
in addition to your everyday normal lives, the patient is like, okay, that's an impossible task. I exited the clinic. I found him smoking. I was like, hello. And he was like, oh, hello, doctor. I wasn't able to. Yeah.
So tips for you guys, if you want to smoke, just go at least someplace far away so the doctor can't see.
Yeah.
So
It was funny. Like me and the patient, we both laughed.
okay. So oral hygiene is, according to all the research, right? It's connected to other parts of the body. So there are research where it's
Yes.
connected to different places. Probably heart, liver, and kidney. So what is your opinion on it?
All right. So your teeth, okay, your tongue, your gums, they carry a lot of bacteria, okay? And it doesn't mean it's bad bacteria.
Okay.
See,
Good
there-
bacteria.
Yeah, not good or bad. Let me explain this to you, okay? So we have natural bacteria living in our oral cavity, okay? And these bacteria are present in a balanced manner, and we call this state the state of symbiosis, okay? Which means you have an around equal balance, proportional balance between one bacterial species and the other, because we have way too many numbers
Billions of bacteria.
different species of
Right.
bacteria. So this is going to be available in the report. We can know.
Oh, okay.
Okay. So, however, when we have a higher number or a lower number of a specific bacteria, okay, in that proportion, okay, we call that the state of dysbiosis, imbalance of bacteria in your oral cavity.
Okay.
And that's where all the problems start.
Okay.
Okay, that is, for example, a certain bacteria, if it increased in number, okay, it could lead to cavities, and I believe it's called Streptococcus mutans.
Okay.
Another bacteria called P. gingivalis, when increased in number, it will cause gum disease.
Okay.
It causes plaque deposits and gum disease. Okay, but for example, if certain bacteria are decreased in number, okay, we will have a higher fungal proportion, because then fungus is going to become strong, and then you're going to have oral thrush, and then you're going to need to be prescribed antifungal treatments. Understand? So the state of balance between microorganisms, specifically bacteria, is important. And through the oral microbiome testing, we can know, okay, if you are in a state of dysbiosis or symbiosis, and then we could treat you accordingly.
Wow. So you're saying that depending on the microbiomes in my mouth,
Yes.
You can find out if I'm going to have a cavity or if I'm going to have, bad breath, or all the different
Yes.
things, depending on the
Yeah.
microbiome in my mouth.
People, as I said,
Okay.
people are different than each other, but we
Mm-hmm.
can predict, like,
Okay.
that you have a certain bacteria that's
Mm-hmm.
gonna lead to you having cavities. That's gonna lead to you having gum diseases. Any problems? We can predict what's gonna happen. We can say we don't know exactly when it's gonna happen, but
Mm-hmm.
sometime in the future it is gonna happen. It could take few months. It could take years. But hey, it's better to approach this right now.
Exactly. So we are predicting it before it happens. Yeah.
Yes.
Perfect. So you're gonna give a report to the patient. So is it going to be a tangible report in
It,
hand?
it, it is going to be a tangible report, but
Hmm.
however, microbiome testing is much more than just pieces of paper. It's
Okay.
like we have this kind of data,
Mm-hmm.
okay, that we will store it, and then as the patient comes to us, we'll be able to access this kind of data.
Mm-hmm.
However, we're going to give them like a simple report of the kinds of the common types of bacteria and uh, this kind, like if you
Mm-hmm.
have an increase in a certain kind of bacteria, it's going to be there in the report because that is something that you as a patient need
Hmm.
to look forward to that.
Oh, interesting. Really interesting topic. Yeah.
Yeah. Now to proceed
Mm-hmm.
with how the oral health affects the entire body.
Uh,
Okay, let's say for example you have gum disease.
Okay.
Okay, the gum disease has occurred due to bacterial deposits in the teeth,
Mm-hmm.
specifically P. gingivalis. Okay,
Okay.
for example, let's say that this bacteria,
Mm-hmm.
okay,
Mm-hmm.
it has the ability through the periodontium around the tooth, okay, to
Mm-hmm.
enter the bloodstream,
Okay.
and from there it's gonna enter to different parts of the body because the blood connects all the body parts
Throughout.
together.
Okay.
So it could transfer to the heart, it could transfer to the lungs,
Hmm.
transfer to the kidneys. You understand what I'm trying to
Got
say.
it.
Anyway, okay.
So bacteria, which is not proper. I mean, it's growing like rapidly, or it is way less in your mouth.
Yes.
Can go to your bloodstream
Yes.
and affect other parts of the.
Exactly.
Okay, got
Exactly.
it. Okay.
Another example, if you have like a severe tooth decay and it
Mm-hmm.
reaches the nerves, it causes a periapical abscess. It's like some kind of lesion, periapical, and
Okay.
from there the bacteria periapical can diffuse into the bloodstream in the same way, migrating to different parts of the body.
Okay. Wow.
Yes.
So everyone, brush your teeth. Yeah, it's very important. 2 times.
Yeah. For example, bacteria could enter the bloodstream, reaching your lungs. It could cause pneumonia or bronchitis.
Mm-hmm.
Okay. It could enter your blood vessels, causing
Mm-hmm.
plaque deposits in the blood vessels, causing atherosclerosis.
Okay.
It could reach to the heart valves, and
Mm-hmm.
it could cause infective endocarditis. Okay.
Wow.
So it could
So
it could
practically, it can affect almost all part of your body,
Yes,
right?
this is why we have a saying in dentistry: everything starts from the mouth.
Oh wow. Everything
Yes,
starts from the mouth.
everything. Psychological
Good. Good.
factors,
Yeah.
health factors, all kind. It starts from the mouth.
So yeah, as I say, like if you think about it, obviously the smile matters. Aesthetic
Smile
also
matters.
matters.
Smiling is good for the
Yeah,
health. Like imagine how it affects you if you're not able to smile
true.
comfortably. That's why you have to take care of your teeth and
Mm-hmm.
like and not lose them or have them decayed or leave them for deposits to take
Mm-hmm.
over the teeth because like you need a nice smile. You need a nice smile. You need good teeth in order to be able to eat and to chew food properly, or
Mm-hmm.
else you're gonna have to like swallow bulks of food, and it's gonna cost you gastric
Gastro,
problems.
yeah.
Yeah.
True, yeah. Nice. So all those different, all this effect is going to affect your teeth is going to affect all these different,
Yes.
diseases very.
Yes.
So what to stop this from happening, right? Like you're gonna do some precautionary treatments, probably cleaning or scaling. So how long? What is the typical period where people need to do this? What's the interval?
So, studies has shown that, okay, that a person taking care of his oral hygiene, brushing regularly, consuming low amount of sugar,
Mm-hmm.
not smoking, should have his cleaning done every 6 months.
Okay, okay. Let me rephrase it. Someone who doesn't smoke, eat a lot
Yes.
of sugar, was
Yes.
like living a proper healthy life, eating our fruits and vegetables. Should do
Yeah.
it every 6 months.
Yes.
I don't know
Because
when is the last time I did.
yeah, because like in the microstructure, so
Mm-hmm.
bacteria does accumulate,
Okay.
and most of our foods that we eat are unfortunately somehow processed, somehow
Uh,
refined.
mm-hmm.
Okay, and bacteria loves this kind of things.
Mm-hmm.
Okay, so our diet is completely different than our ancestors.
Mm-hmm. True.
That's why dentistry has become extremely broad right now. They didn't worry about dentistry back in the
Mm.
days.
Mm-hmm.
Yeah, our ancestors.
Oh wow. Okay.
Yes, I did hear that pharaohs had orthodontists and cleaned
Uh
cavities,
huh.
but I'm sure it's not like our days.
All right.
Yes, which is lucky for me. I have my profession. I'm just joking. I'm just joking. No, my goal is to guide people to have better oral health,
Hmm.
and that's my vision, and that is the vision of the dental department of Biongevity Precision Health and Longevity Clinic.
Hmm. True. Now that every single age group, be it like kids, adults, throughout the age range, people have dental problems. It's become very common. Maybe because of the food habits, or like as you said, right? Every single person is different. So
Yes,
you never know unless you do some test like oral microbiome only, then you'll properly
yes,
find out, oh, this is the problem. This is
yes,
causing this.
yes.
Interesting. Yeah.
Another thing I want to address to, and we need to guide everyone into that.
Mm-hmm.
Um, Everyone should treat his or her teeth as an investment.
Mm-hmm.
Okay, neglecting to treat your teeth, okay,
Mm-hmm.
will lead you to have or to require more expensive procedures in the future.
Okay.
You understand?
Mm-hmm.
A simple cavity today,
Mm-hmm.
okay, if neglected, might need a root canal, post and core, and crown in the future, which is much more expensive. Okay,
Mm.
and if you keep neglecting your teeth, after like maybe 30, 40 years, you're gonna lose all your teeth. You're gonna require implants, and implants, everyone knows, it is expensive.
It is expensive. Yeah.
So, simple procedure, simple regular cleaning,
Mm-hmm.
stress free, no amount of money paid,
Okay.
okay, could give you everything you desire.
Okay, wow. Okay. So always, I think the key is always precautions, right? Like
Yeah, always.
come to your dentist regularly, do your cleaning,
Hmm.
do your oral microbiome, understand what is happening.
Yes,
Yeah,
yes.
it makes sense always. Yeah, sure. So I think winds up today's podcast. So we
Mhm.
learned about oral microbiome, why it is important, why precaution is important, from Dr. Mina here. So thank you. Wait, thank you.
Thank you so much. Thank you.